Welcome to the South Central Kentucky Community and Technical College Nursing Practicum Preceptor Orientation. We would like to begin the orientation by first saying thank you for agreeing to serve as a preceptor for one of our SkyCTC nursing students. Preceptors who assist with practicum are vital in the final step of aiding our students at SkyCTC to transition from their educational role to the bedside and practice. During this orientation, the items that we will look at is the Kentucky Board of Nursing regulations about preceptor use, learning objectives for the course that you will be precepting for, the role and responsibilities of the SkyCTC clinical faculty along with the student and you as the preceptor. We will also look at practicum guidelines and practicum forms that you will need to use or be aware of during the practicum, and then how to complete the process of being a preceptor. First, we will begin by giving you just some general information about the college itself. SkyCTC is accredited by SAC-COC. The mission of the college, as you can see on the screen, is to improve South Central Kentucky's economic prosperity through higher education focused on career development, community partnerships, and economic growth. And the vision of the college states that inspired by our culture of caring, SkyCTC will transfer lives through high-quality education and training. Next, we will go over some brief general information about SkyCTC nursing program. As far as accreditation for the nursing program, as of September 11, 2024, both the PN and RN program is a candidate for initial accreditation by the Accreditation Commission for Education and Nursing, known as ACEN. The program has also had their on-site visit for the accreditation in September of 2025, and we'll know the official result from that in April of 2026. During the on-site visit, the program was found to be compliant in all standards. The nursing program purpose statement for our RN program, which uses an academic career mobility curriculum, states that the purpose of the program is to provide a seamless educational curriculum in nursing with 2 exit points allowing students to choose a career as an LPN or RN. So this program allows students who successfully complete the first year to receive a diploma qualifying them to apply for licensure as a practical nurse and take the NCLEX PN. Following successful completion of the second year of this curriculum, students will receive the Associate in Applied Science degree in nursing that will qualify them to apply for licensure as a registered nurse and take the NCLEX RN. The curriculum is structured around a clearly defined organizing framework and provides the foundation for a competency-based approach to nursing education through the utilization of interactive and student-focused learning strategies. Content and performance-based outcomes for the nursing courses are selected, developed, and leveled from simple to complex. The nursing program philosophy states that the philosophy of the Associate Degree Nursing Program is congruent with the KCTCS mission statement and is supported by the works of NLN Education Competencies and QSIM. The graduate from our associate degree program, having achieved the graduate outcomes, is prepared to practice in a variety of settings with the parameters of individual knowledge and experience according to the standards of practice. Now we will take a look at the Kentucky Board of Nursing regulations on practicum. The KBN states that each nursing curriculum shall include an integrated practicum that must consist of a minimum of 120 clock hours of concentrated clinical experience of direct patient care in a healthcare facility. The practicum has to be completed within a period of 7 consecutive weeks while the college is in session and within 7 months of graduation. SkyCTC chooses to run the practicum with a preceptor model. According to the KBN regulations, a preceptor may be used to enhance clinical learning experience. If that preceptor is used, it shall be done after a student has received clinical and didactic instruction from the program faculty in all basic areas for the course or specific learning experience. SkyCTC students that you will be precepting have completed all coursework, and the last thing they like to finish the program is this 120-hour practicum. The KBN regulation also says that a preceptor shall hold a current unencumbered license, privilege, or temporary work permit to practice as a registered nurse In the state of the student's clinical site, in a practical nursing program, a preceptor may hold a current unencumbered license, privilege, or temporary work permit to practice as a licensed practical nurse in the state of the student's clinical site. You will be asked to fill out a form at the end of this so that we can verify your license as either an RN or PN. Since our academic career mobility program does run the LPN option, some of you all will be precepting for students in Nursing 102 who are finishing up the PN side. We do allow that to be an LPN or RN. Some of you all will be precepting students who are finishing up the third and fourth or the second year of the program who will be setting for their RN license and NCLEX exam. And those preceptors have to hold a RN license. Another thing that the KBN regulation states is that a preceptor shall have evidence of clinical competencies related to the area of assigned clinical teaching and responsibilities. Again, in the form, we will ask you to put your past job responsibilities and job work history. The KBN regulations also say that a preceptor does not replace the clinical instructor. There will be a clinical instructor assigned to each student that is in practicum. That clinical instructor will visit the facility at least twice, and you will have their contact information in case you need to reach them. It also states that the ratio of student to preceptor shall not exceed 2 students to 1 preceptor. We try to keep it 1-to-1, 1 preceptor to 1 student if at all possible. Clinical instructors or nurse faculty also retain the responsibility for student learning and will confer with the preceptor and student for the purpose of monitoring and evaluating learning experiences. As I previously stated, you will see the clinical faculty or nurse faculty at least twice during the practicum experience. And then finally, there shall be documentation of orientation to the course, program outcomes, student learning objectives, evaluation methods to be utilized by the faculty, and documented role expectations of faculty, preceptor, and student. And that is the purpose for this presentation. We will discuss each of these for you as the preceptor. On this screen is the Nursing 102 course objectives, or the PN level of the program. As it has been stated, the RN program at SkyCTC uses a curriculum known as Academic Career Mobility. So after the first 2 semesters or the first year of the program, students can exit or take the LPN boards and set for NCLEX PN. So due to that, they do finish the 120-hour practicum on a PN level. On the screen, you will see the 12 course competencies for NRS 102. Please look over these. They will also be attached to an email you will receive that you can go back and look at these. And if you have any questions, please let your nurse faculty that's assigned to your student or myself know, and we can help you with that. On this screen is the end of program student learning outcomes for each student who completes the first 2 semesters, Nursing 101 and Nursing 102. And at the end of that, should accomplish these end of program student learning outcomes. These outcomes are also attached with the email that you received with the link to this orientation session. Some of you are precepting students who have actually completed all 4 semesters of the RN or Academic Career Mobility curriculum, who are going to be ready to sit for their RN licensure and NCLEX RN. On the screen here, you will see the 12 outcomes, course outcomes for NRS 204. You will notice that these are very similar to 102 with higher level verbs or processing that a student at this level would be expected to do versus the 102 level. Again, these are attached to the email that you've received with this orientation video. And as mentioned for the PN level, here are the end of program student learning outcomes for the RN level when a student completes Nursing 204 and the entire program should be able to accomplish. Again, as with the course objectives, you will see that these are very similar to the PN level, but with higher level verbs, in that the student will be expected to use more critical thinking, more prioritization on that RN level versus the PN level. Again, these are attached to the email which you received with this orientation video. Next, we will discuss the 3 roles that will be involved during the practicum. First is the role of preceptor, which will be your role, which is defined as a qualified professional responsible for supervising and guiding students in a clinical setting. Next is the student. So you will be assigned a student from our RN program, either completing Nursing 102 in the PN level or completing Nursing 204, the RN level of the program. A student is an individual enrolled in a clinical education program who is gaining practical experience under supervision. And then the final role is the nurse faculty. Each student will be assigned a nurse faculty member that will make visits and oversee the practicum for the student. The faculty is defined as an academic personnel responsible for overseeing student progress, coordinating with preceptors, and ensuring curriculum objectives are met. Now let's take a deeper look into what the preceptor responsibilities are. So serving as a preceptor, one of your responsibilities is to provide supervision and mentorship to students in a clinical setting. Next is to offer constructive feedback and assess student performance. We ask for you to help the student, guide them. They have completed all of their coursework, but may still need a little guidance and some constructive feedback. And then at the end, you will be asked to complete an evaluation of the student. So while they're there with you, please be assessing their performance. Another responsibility is to ensure students have opportunities to engage in practical learning experiences. How you choose to do this as a preceptor is up to you. We just want to make sure that the student is being engaged in learning experiences, skill performance, but as well as time management, assessment skills, delegation skills, all of those things. Another responsibility is to communicate with the nurse faculty regarding student progress and any concerns. You will be giving contact information for the nurse faculty assigned to the student, and please feel free to reach out to them at any time with any concerns, and then they will make visits, as has been mentioned, to kind of see how the student progress is going. And then finally, as the preceptor, we ask you to uphold ethical and professional standards in mentoring the student. Let's look at what responsibilities the student has during the practicum. First, they are to attend all assigned clinical practicum sessions and actively participate. They will work with you as the preceptor to set a schedule that they will work to complete the 120 hours. We'll look at that schedule here in just a few minutes. Another responsibility of the student is to adhere to professional standards, institutional policy, and ethical guidelines. If at any time you feel a student is not doing that, please contact the nurse faculty that is assigned to the student. Another student responsibility is to demonstrate respect toward their preceptor, their faculty, and their patients. A fourth responsibility is to be prepared for each session and complete all assigned tasks or assessments. And that would be what you as the preceptor have assigned them to do for the day. And then finally, the last student responsibility is to seek feedback and incorporate the feedback that is given to them by their preceptor or faculty member to use that to improve skills and knowledge. Now let's talk about the nurse faculty responsibilities during the practicum. As it has been mentioned, there will be a faculty member that will be assigned to the student. That faculty member's responsibilities are to select and evaluate preceptors to ensure quality instruction. They will also provide students with necessary preparatory materials and guidance. All students have been met with. They have been given the clinical practicum guidelines and know what is expected of them during this practicum and assignments they have to complete. Another responsibility of the faculty is to maintain communication with the preceptor and address any concerns related to student progress. As it's been mentioned several times during this orientation, this faculty member will make a minimum of 2 visits to the healthcare facility to discuss with you and the student how they are progressing and any concerns that might have arisen. The nurse faculty member will also assess student performance and provide constructive feedback as needed. And then finally, the nurse faculty member will ensure alignment of the clinical experiences during the practicum and make sure that they are aligned with the curriculum objectives. Now we will take just a few minutes to go over the clinical practicum guidelines. These guidelines have also been given to each student that will be participating in practicum. So first, as has been discussed, the clinical practicum consists of 120 hours. Completion of those hours can be done on any day during any shift. They will work out a schedule with you as the preceptor, and it can be done at any time. So it doesn't have to be during the day. It can be night shift. It can be weekends. It can be holidays. Once arrangements and assignment have been made, the student is not allowed to change their assignment unless there is an emergency or the facility itself requests a change to occur. Each student will be assigned to a facility and a preceptor to complete the practicum. The schedule of how those hours are completed is negotiated, as has been mentioned, between the student and the preceptor. Students will receive no payment for clinical practicum time or allowance for travel. The student must abide by the agency policies and procedures when they're there as a student participating in practicum hours. The students must be assigned to the same patients that the preceptor is assigned, meaning that you cannot give a student patient assignments that the preceptor is not responsible for, because the student does not have a license. But as the preceptor, if some of your patients that you've been assigned for the day, you would like to give that student to work with that patient, that is fine, but you just cannot give them patients that the preceptor is not assigned to. If the preceptor is absent or has to leave the unit, the student is not allowed to stay on the unit and must contact their assigned instructor. Sometimes this has occurred if we're getting close to being able to get the 120 hours in. There may be someone else there at the facility that the student could stay with if the preceptor has to leave, but again, this cannot occur unless the faculty member that is assigned to the student has been contacted. Also, during practicum, students must be dressed in their clinical uniform and abide by clinical expectations while at the practicum site. The uniform for the RN students include blue pants and a white uniform top that they all must wear. Also, the assigned instructor will visit the student's practicum site at his or her discretion to monitor students' progress, and as has been mentioned, that will be a minimum of 2 times. During that time, too, when the faculty is there, they will address the clinical uniform of the student and address any issues that may be seen with that. Also, after being assigned a preceptor, the student must contact the preceptor to arrange a schedule for clinical practicum hours. Your preceptor, the student may have already reached out to you as the preceptor or will be doing that soon. That schedule that they arrange must be submitted on Blackboard by the due date, which for these students is October 31st. Any changes that a student makes to that schedule has to be reported by the student to the assigned faculty or instructor as soon as possible, either by email, and then they have to place a new schedule in Blackboard. This is nothing that you with the preceptor will have to worry about. That is on the student to do that. But just know that if they change their schedule, they will have to report that to the faculty member. Students are also required to keep a daily log for each shift that they work. There's some questions and prompts on the log that they have to discuss. They also make up a portion of the student's grade. You as the preceptor will sign that log, verifying the number of hours in the clinical site. So at the top of the form, and I'll show you this form in a few minutes, they are required to put what time they got there, what time they left, and how many hours they've completed. You do not actually have to read the logs or what the student writes to answer the prompts on the log, but mainly you are just signing that form to show what hours that they attended practicum for that day. And then finally, the preceptor will be asked to complete an evaluation of the student during the clinical experience, which will also make up a portion of the grade for the course. The evaluation will be completed by the preceptor using a QR code or link that will be provided to them in the email with the link to this orientation, with also the QR code that you will use to complete that evaluation for the student. The student has been asked to remind the preceptor that this has to be completed by the student's last day of practicum. In the email that you received with the link to this orientation that you're currently watching, there were also several documents attached. One of those was the clinical practicum guidelines that we just discussed. Another is the skills that the students can perform while they are in practicum. For the LPN student or the one completing Nursing 102 that some of you all will have, each student can perform any of these skills along with any other skill included in the scope of practice for the LPN, but students are not to perform these skills independently. The student should only perform skills within the presence of the preceptor that they have been assigned. So if a student is going to start an IV, change a sterile dressing, insert a Foley, the preceptor will need to be with them during that skill to help guide them and give them any constructive feedback and to assess their ability to perform the skill. For those of you who are assigned a student who is completing Nursing 204, the registered nursing or RN level side of the program, here's a list of the skills that these students can perform. Again, just like with the previous slide for the PN portion, each student can perform these skills along with any other skill included in the scope of the RN practice, but students are not to perform these skills independently. They have to be performed within the presence of the preceptor that has been assigned to them. Next, we'll look at a few forms that the student will need to complete during practicum. One of those is the student schedule form. On this form, they will put their name and telephone number that they can be reached by the faculty member if needed. They will also include the preceptor's name, the clinical facility where they're at, and a phone number to that facility. They will let us know what dates they're working, what shift, and how many hours, and if necessary, what unit or station they will be working on in the facility. Students maintain a daily schedule of hours worked with the preceptor, so they will meet with you, come up with when they want to work and complete this form. The schedule is updated as the preceptor's schedule is updated or changed due to staffing assignment of the preceptor, and then it's the student's responsibility to submit this clinical practicum schedule to the assigned faculty. You may not, as the preceptor, see this form, but the student will be using it and submitting it so the faculty member knows when and what shift they are working during practicum. Another form that the student will fill out after the completion of each shift is what we call the daily log entry. This form we discussed earlier during the guidelines, but students are to complete this for each day of attendance in practicum. A couple of things that the form asks them to talk about is their summary of the patient care they've done for the day, what skills and procedures they might have performed, any communication and collaboration they were involved in during the shift, and then any evidence-based practice interventions or activities that they witnessed, and how that evidence-based practice was supported. And then finally, a reflection of what they did well for the day and what they feel like they could improve. Again, you as the preceptor do not have to worry about what the students write for each of these sections on the daily log. The main thing that we are interested in is, if you can see with the red circle, is your signature. This signature is basically stating the student will put the time they arrived and the time they departed from practicum and how many hours they got for the day, how many total hours they have. So the preceptor is signing just to verify that's what time the student arrived and departed and how many hours they have completed for the practicum. As it has been discussed a couple of times throughout the orientation video, at the completion of the practicum, the preceptor will be asked to provide feedback to the faculty on the student using a provided tool. A link to that tool or evaluation to complete will be provided to the preceptor in an email and should be attached with the email, or the QR code should be available on the email sent with this orientation video. This feedback is required for the student to complete the practicum, so we would ask that their last date of attendance in practicum, you complete that. And once you complete it online, we will automatically get the results once you complete it and submit it. Now that you've completed this orientation, there's a couple of things we need you to do to kind of finish out the process of being a preceptor for SkyCTC. First, we would ask you to please complete the preceptor information form at this link, or by scanning the QR code below. You can also find these on the email that was sent. It will take you to a brief form. It's going to ask you a couple of questions about your education, your job history, your nursing license number, so that we can verify that you do have an active nursing license, and just a few other things. It should not take 5 to 10 minutes to complete that form, and then we will keep that in our records. Also, please watch for emails from the nursing program with practicum information and updates throughout the practicum schedule. And then at the completion of practicum, if you provided the entire 120 precepted hours for the student, you will receive a form for proof to use for your 14 CEUs that is allowed when you serve as a preceptor for a student. Again, we just want to say thank you very much for helping our students make this final step in their educational journey. We could not do it without your assistance. And as stated, again, we cannot thank you enough for serving as a preceptor. On this screen, you'll see a couple of pictures of some of our recent graduating students from either a practical nursing program or a registered nursing program at both Glasgow and Bowling Green. Again, thank you very much, and please let me or the assigned nurse faculty member for your student know if you have any questions during the practicum. Thank you.